Iti. Iti.
They debate over sexual and reproductive health rights. SRHR in Malawi continues to make headlines with the contentious termination of pregnancy (OP) bill sitting at the heart of a complex intersection of law, culture, and public health. At its core lies a persistent reality: unsafe abortions and limited access to comprehensive reproductive health services continue to pose risks to women and girls, particularly adolescents. Yet, discussions around these issues remain constrained, often shaped by stigma, misinformation, and deeply rooted social norms. Now a new battleground is emerging, not in courtrooms or parliament, but on smartphones. Stakeholders say social media could be the missing link in advancing a more informed, inclusive, and evidence-based national conversation on SRHR. At the center of it, there is a multi-stakeholder initiative designed to strengthen how information on sexual and reproductive health rights is shared, especially among the young people. This is Fupa Lokakamiza. Instead of focusing only on service delivery, it zooms in on communication. This is how messages about issues like contraception, post-abortion care, and the abortion debate are created, packaged, and spread. Think of it as a kind of message engine. It brings together journalists, NGOs, health workers, and youth champions, then equips them to push out clear, accurate, and youth-friendly SRHR content, largely through digital platforms. The Young Voices organization, YVO for example, argues that digital platforms offer an unprecedented opportunity to reach young people who form the majority of users online. YVO project manager Emmanuel Namponya says the challenge is not access, but the strategy.
Today we are having a co-creation meeting with communication stakeholders, and this is under the Fupa Kamisa project, which is being implemented by Young Voice organization. This is a 7-month project whereby we want to disseminate information relating to sexual reproductive health and rights using the social media platforms. So today we're meeting with communication stakeholders for them to help us in structuring the messages, topics, as well as questions that we'll be using in our implementation of the activities. Mainly, the program is about disseminating information on critical issues relating to sexual and reproductive health and rights, as well as issues to do with safe abortion, whereby we want to use social media platforms like TikTok, Facebook, YouTube to share information, contentious information that people don't usually like to talk about, but want to spike conversation on social media platforms when it comes to the issues to do with sexual and reproductive health and rights. So we'll be targeting a different number of people, especially those people who are found on the social media platforms. So we'll be bringing in sexual and reproductive health and rights experts, as well as the social media influencers to help us in disseminating the information relating to sexual and reproductive health and rights. And mainly, we want to create that synergy between the people as well as the SRHR experts, so that they should be able to share conversations around the SRHR on social media.
For many young Malawians, social media has become a private gateway to public health information, a place where sensitive questions can be explored without fear of being judged. Santorina Chaplain of the Chipembere Community Development Organization, CCDO, notes that the SRHR goes far beyond the abortion debate. She says it includes post-abortion care, family planning, contraception issues that young people need to understand.
So this engagement is very important as we are working as organizations, working in the communities, in SRHR advocates. We know that SRHR is a very broad issue. So we are talking about SRHR in terms of safe abortion, contraception. So there are so many issues that we are discussing. So particularly this meeting is very important because as advocates, SRHR advocates, media practitioners, we are here to discuss the communication strategies that we are taking to the communities, because there are many times that we talk about SRHR, we talk about safe abortion, we talk about family planning issues, but then we cannot put it in the light communication, in the light strategies that we will tackle the communities that we are serving. So this is a very great platform, and also we are also tackling issues of media, using of media and social media platforms to navigate these issues so that we can discuss in all the platforms that we have. We talk of Facebook, we talk of LinkedIn, we talk of TikTok. People should talk about these issues. People should talk about safe abortion. People should talk about sex without being intimidated, without being shy. So we are here. These 2 days meeting and stakeholders meeting engagement will be impactful to us as SRHR advocates and as youths. Thank you.
Her observation reflects a shifting reality. While communities may hesitate to openly discuss SRHR, digital spaces are quietly hosting these conversations in real time. Malawi's restrictive abortion laws continue to frame the national discourse, but legal developments have begun to stir a broader conversation. The AC Minor versus Attorney General case, for instance, has become a reference point in discussions around minors' rights and the access to reproductive health services. While the case did not directly legalize abortion, it highlighted the critical gaps in how the law addresses young people's health needs. Today, such issues are increasingly being unpacked on social media, simplified into threads, short videos, and infographics that make complex rulings accessible to ordinary citizens. Penelope Kamanga, Programs Officer at the Center for Solution Journalism, believes this shift is significant.
It's been used to raise awareness. You put issues on SRHR, you put it on social media like Facebook, Twitter. You can share issues. That there was a ruling that was done recently. Using that, we can actually make sure that the youth who are mostly there can put we call them a piecemeal of the ruling so that they understand, or anything that we want to use on SRHR. But we can also use it for setting an agenda. Like if you want to campaign for something, I could use it for campaign. Mostly.
Irene Matanga, program lawyer at the Nyali Institute for Sexual and Reproductive Health Governance, shares similar views, stressing that digital engagement can help bridge the gap between legal frameworks and public understanding.
Social media is a key component in actually communicating what the judgment is about, what the law is, in simplified terms. So really reaching the people and really explaining to them what their rights are under the Gender Equality Act. So social media plays a critical role in disseminating the judgment and the law as it stands right now.
Malawi's SRHR debate does not exist in isolation. The country is a signatory to international and regional frameworks such as the Maputo Protocol and the Convention on the Elimination of All Forms of Discrimination Against Women, both of which advocate for expanded reproductive rights, including access to safe abortion under certain conditions. Through social media, these global commitments are increasingly entering local discourse, often reframed in ways that resonate with everyday experiences. But the tension remains. How do these obligations align with Malawi's social, cultural, and religious values? As the institutions navigate this topography, social media influencers are stepping into an unexpected role, that of informal educators. Here are some of the influencers who share their perspective.
I believe that social media can be a very powerful tool when it comes to advancing conversation around sexual and reproductive health and rights. As one of the influencers, I have seen how much trust and engagement exists between creators and their audiences, and that creates a real opportunity to share important information in a way that people actually relate to. If we take sensitive issues like termination of pregnancy, social media can help break the silence, reduce stigma, and open up space for honest conversation as it involves the crowd and everyone. It also allows people to hear different perspectives.
Their experiences point to a growing trend, the democratization of health information, where authority is no longer confined to institutions but shared across digital voices. As the TOP debate continues to unfold, social media is amplifying not just opinions but critical questions. If young people are already seeking SRHR information online, who is responsible for ensuring that the information is accurate and safe? Does restricting open discussion on abortion reduce its occurrence, or does it push it further into unsafe and unregulated spaces? How can Malawi reconcile its cultural values with its obligations under international human rights frameworks? These questions are increasingly defining the tone of the online engagement, urgent, complex, and often unresolved. Amid this evolving landscape, initiatives like Fupa Loka Kamisa are being praised for recognizing the power of digital communication in shaping public discourse. By promoting strategic, responsible, and inclusive messaging on SRHR, the project is helping to transform social media from a space of fragmented opinions into a platform for informed dialogue. In a country where SRHR conversations have long been muted, the rise of digital engagement signals a shift, one where the future of the debate may well be written in posts, shared in stories, and argued in comment sections. And as Malawi scrolls through this unfolding conversation, one thing is becoming clear. The question is no longer whether social media should be part of the SRHR debate, but whether the country can afford to ignore it.
Muliwege kufuni anu ndufuna ndaona nyamata mikosi amakomesa ma Facebook ndufuna ndimone jamii aja sikana wera kati mazi ya kumwa ndufuna ndauza dati kumaboji.